For many families, the final chapter of life is filled with uncertainty. Questions about care, comfort, and what comes next. Hospice is a holistic, team-based approach that prioritizes comfort, dignity, and quality of life for terminally ill patients and their families.
When people talk about end of life, it's no longer the taboo. And I think in the healthcare arena, it's been helped to evolve because anytime you go to your physician, you go to a hospital, they're required to ask you about your advance directives.
Years ago, many patients and families, they didn't even want to hear the word hospice. If you first talked about it, they would immediately dismiss you. Now, it's much more welcoming.
I think so many families wait till late in the process to consider hospice care because still today, there's a lot of misconceptions around what hospice is and isn't.
And a lot of times it starts with their healthcare provider to empower them with the understanding of how to prognosticate, how to have the conversation, and really understand what is the value that hospice can bring their patients, dispelling those myths so that those trusted healthcare providers can offer patients and families empowered choice in their serious illness journey.
Choosing end-of-life care does not mean giving up. Hospice focuses on quality of life by managing symptoms and providing comfort and connection with loved ones. Across the country, hospice teams are redefining how patients and families are supported through compassion and understanding.
Traditional medical models really focus on health as medical conditions. And how do we optimally treat those conditions in hopes of delaying progression? Despite those therapies, these conditions often do progress. At that time, we often take a step back and think about compassionate person-centered care.
When we think of compassionate patient-centered care, we want to take all of those parts of a person that makes a person human. We want to bring care to every single part of that. And it's really what sets hospice apart from other medical.
In the 1970s, when VITAS Healthcare was established, what happened was care really focused mostly on cancer patients. And so hospice, through its interdisciplinary care, really helped people be in location of choice and with better symptom control. Now we focus on all types of conditions. We also had changes in what's important to people. With hospice, we still offer good pain and symptom management, but at the same time, we can support people on complex care plans that they can be at home.
It was just a matter of people wanted to have that ability to have a say in the way their end of life goes.
For nearly 50 years, VITAS Healthcare has helped patients and families navigate life's final journey with compassion, expertise, and respect. As the nation's leading hospice provider, VITAS delivers care wherever patients call home, bringing comfort and support to both patients and their loved ones.
We support families through grief, spiritual care, and beyond by making sure that we have trained clinicians, chaplains, spiritual caregivers who are very well trained. One of the things that we do is not only do we provide bereavement and grief care for the family after the death, we actually begin it before the death.
It's really just a matter of providing that individualized support and understanding.
When patients transition to hospice, it's really important to maintain continuity of care. We work together to ensure that the stream of information goes back and forth so that patients continue to receive comprehensive care and nothing is missed.
And once families find themselves surrounded by that support, they realize this isn't about what I'm losing, it's about what I'm gaining, right? And it's about the right care at the right time, and that's what VITAS delivers.
With a legacy of innovation and compassion, VITAS Healthcare continues to lead the way in hospice, providing patients with comfort and dignity, while guiding families through every step of the journey.
Most people misunderstand hospice because there are many myths that surround end-of-life care. And so it's the role of VITAS and the hospice community to really make sure that healthcare professionals, patients, and families understand the benefits of how hospice can support them in their end-of-life care journey.
By the time a patient is referred to hospice, the family is already crumbling. If hospice can be brought in much earlier, that we can help patients and families.
The future for hospice care is a great opportunity for us to continue to serve the healthcare continuum. There's a silver tsunami, as you call it, of baby boomers turning 65, and so there's going to be more and more strain on the healthcare system, and so it's very important to continue to integrate technology.
The future of VITAS and hospice care continues to look bright. We know currently still only about 50% of people who die in the United States access hospice services. So we have a lot of work to continue to do to help patients and families understand that they are near the end of life and that they have options. And one of those options is hospice. What matters to you? How can we make that happen?
For more information, go to VITAS.com or call 800-93-VITAS. That's 800-938-4827.